Hi, my name is Karen Sheldon. I'm a nationally certified interpreter. I have worked previously in educational settings, in an elementary setting, and also secondary, college, university level interpreting. And for the last few years, I've been interpreting in the medical field. And it's really a different type of interpreting to be working in the medical field than educational settings. My work prior to interpreting was in group homes, so I already felt comfortable in a medical environment. I took my clients often to appointments, and so I felt pretty familiar with the process of attending appointments and the type of language and dialogue that took place at medical appointments and in hospitals and clinics and things of that nature. But switching into the interpreting role required attention to a different skill set. One of the things that I find is most important when working in a medical setting is managing the role of the interpreter and the information that's happening in that session. And of course, that's always the goal of the interpreter, is to manage the information between the people you're serving. But in a medical setting, it's really dependent on understanding the doctor who knows a lot and the client who maybe doesn't know, the consumer who maybe doesn't know quite as much or understand as much about the technicalities of what's being explained to them. And being able to gauge their level of understanding and how much you need to expand upon what's being shared from the physician or the nurse. And what that requires of the interpreter role is being able to interject as necessary into that role and stop the physician if necessary, so that there's an opportunity to explain and expand for the purpose of clarity, to make sure that the consumer understands the information that they're getting. And when you consider it from a control demand perspective, the demands there are both to get the information across to the consumer, but also so that the deaf consumer can make use of that information after they leave the office. And so the controls you have there are to slow down the process as necessary. Physicians are often used to presenting information at a pretty quick pace and using language and jargon that maybe a hearing person is more familiar with, or if they're not, a hearing person perhaps has more opportunities to follow up with family members or other resources, Google, the internet, to follow up with the information that they've been giving in the appointment. The deaf consumer might not have those same advantages. So it's really on the interpreter to make sure that the information is and the understanding is happening the way that it's supposed to in that appointment. The reason I mention that specifically is because if you're not comfortable in a medical setting, if you're not familiar with the level of power and authority that doctors bring into an appointment room, that can be a little uncomfortable to be able to present yourself enough to say, one moment, I need to expand on this further for clarity. And also making sure that as the interpreter, you have a firm understanding of what it is the doctor's talking about or the nurse is talking about, and being able to ask for clarity on your own end if that's what's necessary. I also found in the medical field something that was really important, something that I wasn't really well versed on, is medication names and medication generic names. Those are important because that's something that comes up pretty often, and it's nice to have a background information about what medications they might be referring to, what the uses and purposes of those medications might be, and then being able to transfer that information to the client through fingerspelling. One of the things that's often pretty tricky is that the deaf consumer might not know what medication you're referring to. They really know more the shape of the pill or the color of the pill, or it comes in this kind of bottle, or it has, if it's an eye drop or a nasal spray, it has this color cap. So you're going to get more of description aspects of the medication rather than the names, or perhaps the doctor's using the actual name and the deaf consumer uses a generic, So having some background information about those different aspects of the medical field are important. That also goes back to like prepping for the job. Best case scenario, when you get a medical appointment, you get an idea of what kind of job it's going to be dealing with. Are you talking about the heart? Are you talking about the lungs? Are you talking about skin? Like what are you going to be addressing in that appointment? The reason that is important is because that goes back to the medications that might be used. Maybe you're going to be talking about topical creams. Maybe you're going to talk about, certain medications for high blood pressure and things of that nature. So it's a good idea to know what kind of medical appointment you're getting into before agreeing to go. Now, when I started with medical appointments, I started with kind of basic things, eye doctor appointments, routine checkups. And as my comfort level developed and my familiarity with the medical setting improved, I have been able to take on more complex jobs and felt more comfortable in scenarios that maybe are a little not higher priority, but where they're dealing with a little bit more difficult level of medical nature things. And that's has to do with my growing comfort level and my experience level with the language and the turn taking and things like that. I also had a wonderful opportunity to participate in a local fellowship, and that fellowship was 40 hours of working experience with a staff interpreter at a local hospital. And that experience was really wonderful for a number of reasons. It really increased my comfort level in being part of that medical environment and taking the time I needed to make the information clear and feeling like I was an important part of that transition of information, and if that transmission, of information, and if I needed to stop the process and work with that information more, I felt like being in that fellowship gave me the opportunity and the skills to feel comfortable doing so when necessary. I also got to see how a staff interpreter working for that hospital or that hospital system becomes part of the medical team, and they are recognized by other medical professionals in the building, and they're seen as kind of an equal in that system. And so that was interesting to see the way that dynamic was impacted by somebody a face they recognized and were familiar with and used to seeing in their offices. It made the job go much smoother when the medical professionals knew what to expect from the interpreter and the interpreter role. Finally, I found that fellowship a wonderful opportunity for networking and opportunity for professional growth. I made a lot of connections through that networking opportunity through the fellowship, and actually has opened doors for me now to be able to be on call for that medical system, which is really wonderful. You see a variety of different people, you see a variety of language styles and consumer attitudes, and has really, really broadened my skill set and my understanding of people and what their needs are and how their needs are best met. The thing about medical appointments is that every type of person needs a medical appointment. People who are very highly educated and linguistically savvy need medical appointments, just like someone who has minimal language skills and where the job requires more gesturing and moment-to-moment, figuring it out on the job and making the best of what can be a difficult situation. And that is what I find really exciting about the medical field. You meet people when they're really in need and when they are really invested in the process and invested in the communication. And so medical interpreting has been really fulfilling for me so far and really exciting. One of the things to consider about medical interpreting, however, is that it's not for everyone. Like I said, my experience in the group home previously made me really feel comfortable in a medical setting. Lots of my family members, my mom, have worked in hospital settings since I grew up, so I am comfortable in a medical setting, but many people aren't. You come into contact with the sterile hospital environment, the medical rooms, you're dealing with people having blood draws or doing physical examinations and things of that nature. And every consumer has a different comfort level with an interpreter in the room, but the interpreter really needs to know themselves and know what they're comfortable with. Sometimes the information being shared in the medical appointment is really sensitive and really delicate and emotionally charged. And all of those things require the interpreter to understand what they're capable of, what their limits are, and if they can handle that or not. And so being able to be aware of your emotions and what you're able to tolerate and what you aren't is good when you're going into the medical profession, and knowing that sometimes the unexpected is going to come up in a medical setting and be prepared to roll with the punches. So I've really enjoyed the medical interpreting, and I look forward to doing more and more of it. And it's really exciting to be with people in what is sometimes their greatest time of need. Thanks.